Hello, everybody. We are getting ready for our Lent retreat. It's around the corner and it's only a few weeks away. And before, as a preparation for a retreat, I would like to share with you some of the tools and some of the concepts that we will be using during the retreat. I will use, I will share with you a PowerPoint with those concepts in this presentation. And hopefully you will have a time to sit with those concepts or perhaps maybe explore a little farther and look on internet or books about it. And that maybe by the day of the retreat, you already have these concepts internalized. And with the parts you agree or disagree in these concepts. I will share a PowerPoint. Just a minute. Here we are. So my name is Federico Gianelli. I am a Jesuit. I am a scholastic Jesuit doing Regency at Verbum High School. In the diocesan formation will be the equivalent. I am a seminarian. But even before I entered the Society of Jesus, I am a professional chaplain specialized in palliative care medicine. So many of the tools that we will see, many of the concepts that I will share with you, co-facilitating this retreat with my brother Jesuit, Father Chris Wright, those tools I have been using in chaplaincy at the bedside, but I also has been using them to provide a spiritual and emotional support for staff members of the hospitals. Also for a caregivers, professional and non-professional, medical and non-medical. So our concepts, those concepts has been used, they prove they work. And I would like to share with you some of them. I'd like to start with a person that I wish I had met, and I wish I had the opportunity to listen from her besides videos. And her name is Dame Cecily Saunders. She was a nurse who hurt her back during the training and became what we call today a social worker. She later became a physician and a writer. And she opened what has been called St. Christopher Hospice in London. Cecily Saunders, as she started to take care of the suffering of the person or the person who was suffering, she came up with this concept of total pain. We have to look for the whole person, and we have to look in the whole person for that pain that is beyond physical pain. She also developed what we call, and we call her the pioneer of the modern hospice. And the care that she developed, the patient-centered care, as the main concern of the whole interdisciplinary caregiver team, became the model that later gave birth to palliative care. So what I'm trying to say here is Dr. Saunders brought to us a legacy of look for the whole person. And in the whole person, we will look for the whole pain, of the total pain. As we look for the total pain, we look in all the dimensions of the person. We are going to a retreat, and like when we met a patient for a first time, when we met another person for a first time, we are invited to look to the whole person, not just to the spiritual, not just to the physical, not just to the social, not just the intellectual or the emotional, but the whole person. Let the whole person bring her, himself to us, and let's discover that person with what that person wants to share with each of us. So here is a first idea that I like to invite you to once come to the retreat as the caregiver that you are, and in whatever field you are, but also bring yourself as that person that can be a patient. That person is a wonderful book that says, um, a call, sorry, the wounded healer. So we are healers, but we are healers because we were wounded, and we are wounded. As we go through our wounds, we are able to become a healer for others. So that will be the concept for this, one of the concepts for this retreat. Please, you will play, if you may, as a patient and caregiver. In both, you will take care of your own self. You are taking care of your own person as a caregiver, but also as the person who is identifying what she or he needs. Um, Retreat, day of recollection, it is that. It's a time where we do what St. Ignatius will call the cura personalis. We will look to ourselves and we will take care of ourselves. We will take care of our souls. And that is a spiritual retreat. That is a time of reflection, a time of recollection. As we advance, so I'm going to use this graphic. This graphic in a way exemplifies, but also presents the opposite that I'm trying to say. So we can identify, we can divide a person in four specific dimensions or basic dimensions, but as we talk and as we study, but as we approach the whole person. So again, is that invitation to see the person. Maybe if I'm talking to a person who is spiritual and is religious, if I say, oh, every human being has a spiritual dimension, it's not new. I'm preaching to the choir. But many times, and I had the experience with medical students, with social workers, with people from other field than a spiritual care field, that for them the spiritual dimension is something new, or is something to be developed, or is something that it has not been seen as in essential part of the whole person. So the spiritual dimension is that part of the whole person. But also, if I'm talking to somebody who is spiritual and is religious, I will say, your physical dimension, your intellectual dimension, your will dimension, I call it will, the dimension of being able of make decisions is also dimensions that you have to take care. So when we come to a retreat, we may think that we are here to take care of our spiritual and religious dimension only. That is my relation with God and God with me. And all of that is true, but be aware and be open that other aspects of your life, other aspects of your personhood, all other aspects of your being, other dimensions of your being, of you being a human being, will come to the surface, will show up during your retreat. one tendency is to put it aside and says, "Oh, this is not part of the retreat." Is disconnect, is divide, is separate all of these parts. No, we are looking for the whole person. We are inviting to you to look to yourself. You are taking care of yourself. Let's say my name is Federico. Is Federico taking care of the whole Federico? Not just Federico's relationship with God, but also Federico's in the whole person, and whatever it comes up, as we will say later, maybe God's will of what we have to take care. We will see some concepts and spiritual care and professional spiritual care has been a little bit challenged. Is a few books that I will give a bibliography at the end of the presentations and during the retreat that you may would like to explore. Unfortunately, because the professional field is new, the spiritual care professional field is new, we don't have concepts where everybody agrees with. We don't have if we talk about physical pain in the medical field, across the medical field, every, how we call, specialty, every field knows what physical pain is. Unfortunately, for spiritual pain, for spiritual dimension, for spirituality, those concepts we're still in process to identify the basic or the most characteristics that will work for everybody. So what I will do is I will provide few of them. You will resonate with some you will not. I would just invite you to open heart, open mind, to sit with them and see how may translate or may not translate to your own life. So spiritual dimension is presented as a spirituality. Spirituality is the aspect of human that refers to the way they experience their connectedness to the moment, to self, to others, to nature, and to the significance of sacred. This concept has come from the Journal of Palliative Care Medicine and is the fruit of a consensus conference. It was a project developed by City of Hope and Archstone Foundation. About 10 years ago, I was part of this process where the grant and the project was to develop spiritual care in palliative care and come up with some concepts that will help across the fields to identify tools to work with patients. The pioneers in this concept is Christina Pulchaski and Betty Farrell. Both are professors, researchers, people has been pioneer in palliative care. As you know, many know, all the hospital departments has to be certified by the Joint Commission. And the Joint Commission also has a definition of spirituality or spiritual dimension. And they would define as the individualized subjective experience the individualized subjective experiences of and from which a person derives purpose, meaning, and hope. I would like you to just keep mind and heart open, because you will see across the field in the different definitions, some words, some aspects are common. So if you, as a reference there, if you like to explore a little bit more. So something very interesting for me was learn Joint Commission to certify a hospice team needs to have a professional chaplain on board, somebody who will provide the spiritual care, somebody who will provide care for the spiritual dimension and for the religious aspects. So it's very important because it's a move to see the person not just a number, not just a diagnosis, not just a medical concept, but to see the whole person and recognize in that whole person a spiritual dimension. Spirituality can be seen as a dimension of personhood where religion is a constructor of human making which enables the conceptualization and expression of spirituality. We may agree, we may disagree. Again, we are exploring what is up there. Going back, it does says in the beginning, it recognize, and I think there is one of the limitations, can be seen as a dimension of personhood, literally says, no? So that means it is in the person. How it is in the person, I think, is one of the limitations or challenge that is still to be presented. Spiritual dimension. The spiritual dimension is described and is interpreted as the need for meaning, purpose, and fulfillment in life, hope, will to live, belief, and faith. As the spiritual dimension is important for the attainment of an overall sense of health, well-being, and quality of life, referred to as the health potential, and as a illness and hospitalization can be precipitate spiritual distress. Patient's spiritual needs should be addressed. This is very interesting. First, because it kind of repeats many of the aspects that we saw in the previous definitions. And also, I like few things that manifest there is, well, as part of the well-being, is part of the sense of health, is part of quality of life. So one of the aspects that the medical field is looking today is for quality of life, how to improve people's quality of life, how we improve our quality of living, you know. And as we come to this retreat, you know, we are maybe not in a hospital bed, we are maybe not diagnosed with an incurable illness, but we also are looking for quality of life, especially in this time of COVID, where our quality of life has changed significantly. I like the last phrase of this concept. It says, as illness and hospitalization can precipitate a spiritual distress, patients' spiritual needs should be addressed. Well, some of my stop moments during this pandemic since March last year is, before the pandemic, we were distracted, we were busy, we were doing so much that will keep us, and I'm generalizing, no, but will keep us unaware of those aspects of our own self that should be taken care. As COVID comes, as we become locked in with a home by ourselves or by those relationships that are meaningful to us, as we haven't had the opportunity anymore of being busy and distracted in many things that we used to before, many aspects, especially those that are more uncomfortable, start to come to the surface, not to the top, or has to come, start to come outside, you know, in the superface of our daily life. And we start to notice them. And now we have to deal with them because we are no longer with the possibility of ignore or cover or just put to the side and keep going because we have all this time free. It's very clear for me about relationships that were having difficulty before, but because the parts were busy, were doing their daily life, now they are spending more time together. Now they are at home. Now they are dealing with each other. Those problems, those differences, those difficulties, those challenges are more evident. And the last one is one of my favorites. A human capacity of transcend their own self, connecting with other outside of them. This concept I learned early on as a young seminarian, and who presented this was Father Cirilo Marichal, a Salesian priest, who used to give us, used to be our professor at the university, and he used to teach us anthropology philosophical and anthropology theological. And he will say, well, the spiritual dimension is that capacity that every human being has to come out of her, himself, and connect with is outside of them and different of them. So that means that can be God, that can be others, that can be nature, that can be a style of work, that can be many, many different things. And I think that is one of the invitations for this day of recollection, to keep in mind what it is for you, your spirituality. So again, we'll go back. By the way, Father Cirilo Marichal was the one who taught me this graphic about 4 basic dimensions of the human being. Remember, we approach the whole person. We are trying to look for the whole person, and the person has more dimensions than just 4. This is just educational. This is just to start the conversation. So we have the spiritual dimension, and who deals with the spiritual dimension? And here I will kind of give some tips very fast, but that may shape your understanding of spiritual care and of chaplaincy, and maybe helps you to grasp a little bit more what we are trying to accomplish by using these tools. So the chaplain. Normally, chaplain in our Roman Catholic tradition has been a priest who is assigned to a specific field: hospital, the army, the schools, a family in the old days. But it was a ordained minister, we will say in another language in the US. It was a Roman Catholic priest. Well, by chaplain means, we understand, is a woman or man that has been trained on the spiritual dimension domain. That is trained also in a faith tradition. That person has a faith tradition, but that person has been trained in that faith tradition and others. But overall, the person is trained on the spiritual dimension. Can be a woman, can be a man, can be ordained, can be no ordained, can be a person that has done college, has done professional training, and has to be certified. It has to be recognized by associations that have a common standards. So I will go a little bit deeper. Again, when we talk about the person, we talk about the whole person. The chaplain is the person specialized in the spiritual dimension, But something that palliative care brought and is new, the chaplain in palliative care has to know about the physical, about the intellectual, about the emotional, about the social, because the person when and you, if you have done spiritual direction or if you have done work at the bedside, when you visit the person is ill, the person tells you what the person has in her or his heart. Many times they may think or assume that you want to be there just for the spiritual, but many times they don't. They will share with you what is more urgent to them. And it's important for us to listen, to be present, to be there for that person in what that person is needed the most urgent. That will be the chaplain. Again, I like this chaplain color. I use this at Stanford University. When I was teaching one day, I developed this chaplain in many words because it's not one type of chaplains. Chaplains come in all shapes, size, and races. No, I don't know if that raises the word, but in all shapes. It's not one type of chaplain. It's not just a Roman Catholic priest. It's from almost all faith tradition has a chaplain and has a professional chaplain field, and can be woman, can be men, can be from all cultures, many language. I've been blessed to work at the General Hospital with St. Camilla's Center, and I was trained there. I was there for almost 5 years, and we're 27 chaplains from different faith traditions, not just Christian, but from other many different traditions. And the same thing, Stanford University, when I was there, we have this interfaith department that will have students for chaplaincy, but also will have chaplains for, I don't remember exactly, I think it was 27 or 48 different traditions and language. So it's enriching as when we can see we are in this mix of how you say, different traditions. Again, as I mentioned, it is there and is as will be as information almost than anything. Those are the associations of Catholic chaplains in the U.S. and also I think is Canada around there, and they have in common the standards and the codes of ethics. That is very important. Chaplains are accountable for their clinical pastoral work. For example, me as a Roman Catholic chaplain, professional chaplain, I belong to the National Association of Catholic Chaplains. That is a institution under the National Conference of Catholic Bishops. Again, to be a board certified chaplain, you have to have a Master Divinity or equivalent. You have to have 1,600 hours of clinical pastoral education program. You have to go for board certification, and that certification for general chaplaincy will be renewed every 5 years, and for palliative care every 3 years. The certification for palliative care it comes after the certification as a chaplain, and has a focus on a specific training on the palliative care and hospice fields. Again, we go back. So here we are moving to a new big concept in our presentation, and it is, we say the chaplain is the person specialized, is the person trained, is the person that deals with the spiritual dimension. Something that if you work at the medical field, you will hear this is The palliative care chaplain is the specialist of the spiritual dimension, but is the generalist of the other specialties in the team. And there is something that is kind of new and challenged for every field, for the chaplain field, but also for the medical field, for the social worker field, and for the nursing field, physician's field, is we all know as a generalist how to read aspects of the field that we are a generalist. So we can refer to the person who is specialized. That means the need will be addressed sooner, and we believe that that will bring quality of life. So saying that, and I will not repeat what we say about chaplains, ordained or ordained, chaplain will deal with the spiritual, existential aspects and with religious aspects. Towards to the bottom of the slides, you see in red spiritual distress and spiritual pain. And I will talk a little bit about this. When then Cecily Saunders was looking for total pain, she identified that pain was beyond the physical. And here is what we call a spiritual pain. And I will talk more about spiritual pain, but the first note I would like to share with you is spiritual distress and spiritual pain many times are taken in the same, as the same. And the more academical and more specific field will be two different things. And how it presents, it will be something like the spiritual distress is a symptom of spiritual pain. For example, if I have someone who cannot sleep, or falls asleep and wakes up, and I go the next day to visit that person, looks tired and looks didn't have a restful night, and I explore with her or with him, I say, well, what happened? And normally they will say something like, oh, I couldn't sleep. I've been having insomnia. And I said, well, have you been thinking? And they will normally say, yes, I've been thinking. Well, what you have been thinking of? What is going through your mind? And they will share. One example something that was very frequently, very common in my clinical practice was the person will say, yes, I've been thinking about death. I've been thinking about dying, especially those patients near death. And when they say, oh, I've been thinking about dying, and it's why I cannot sleep, many times the first invitation for many people, the first need that many people feels is, let us pray for. Or is, oh, you are not there, don't talk about it, you don't need to talk about it. Or, yeah, no, don't worry, we are not there yet. So what we do, what the person does, the person who is listening does, is shutting down the person is sick and the person that cannot sleep. But versus to say, don't talk about it, or we are not there yet, or don't worry about it, we say, well, what aspect of dying is keeping you thinking? What aspect of dying is maybe scaring you? What aspect of dying you have been uncomfortable with? And people in general will say three things: a worry about physical suffering, a worry about leaving the loved ones, and what is next. So let's take the one about leaving the loved ones. Maybe you can drop there and says, no, say something that will finish the conversation, but you also can say, well, tell me about your loved ones. Who are they? Who you are close the most or the less? And normally it will shows up a broken relationship with a loved one, something that has been there or has been carrying for many, many years. So we went from I cannot sleep to a broken relationship. I cannot sleep is the distress, is the symptom of spiritual pain, of this broken relationship that if the person dies before the relationship is fixed, is causing unfinished business and is causing all of this distress, anguish, insomnia. So it's very interesting how we can go deeper and look farther than what we are seeing. At this point, we can say, and I will repeat this a little bit more, when we talk about spiritual dimension, we talk about something that is broader than religion. We talk, sometimes the spiritual dimension, religion has been taken as synonymous. Now we're talking about something different. It's, religion is part of the spiritual dimension, but the spiritual dimension is broader. And if you like to explore what your spirituality or what your spiritual dimension looks like, one exercise that you may can do is just for a week, create a chart or charting of what you do since you wake up until you sleep. And you will do a list of things that you repeat every every day. Well, try to apply some of these concepts to those things you repeat the most. You will be surprised. Spiritual pain. So now we can move, and this will be the beginning of our retreat, especially the first part of our retreat, how we come to the retreat, how we bring ourselves, and what we are carrying on, what COVID-19 time has developed, unveiled to us, has opened up to us as a personal growth, as something that we have to become aware of. So I mentioned at the beginning the wounded healer. So when we go to chaplaincy training, when we go to the clinical pastoral education program, we think we are going there to be trained how to minister to others, or how we learn techniques that will help us to connect and provide care and listening and presence to others. And yes, that's true. But essentially, one of the basic things that we learn in the chaplaincy training is to identify our own wounds, to identify our own needs, to identify what we are carrying as a wounded. Is an exercise that I love it, I call verbatim, where you put word by word of a interaction with a patient. And so you write what the patient says, you write what you say, you write what the patient says, you write what you say, and it's a column where you put how you felt at the time, how you were feeling at the time the person, you were having this conversation with the patient. Well, after the first or the second one, you realize the many of what you said at the encounter with the patient, with the other person, It wasn't to comfort that person in front of us, that person in front of you, but was to comfort our own selves, our own goods, our own uncomfortable feelings of being in that conversation. That is the example, going back to the example of the person who is afraid of dying that cannot sleep. When we shut it down people, you know, when we say, oh, don't talk about this, oh, you are not there, oh, don't worry, oh, everything's going to be fine, everything is going to be okay. Most of the time, it's not because we are looking to comfort that person, but to comfort our inner uncomfortabilities, our inner wounds, our inner, um, I don't know if you can say this, but incapacities of talk about that topic. I encountered that with second year medical students, you know, when we used to present a movie, and it was so clear, you know, on one side, all this desire and ego to serve and cure and take care of the other person, but how personal aspects will prevent of a right to certain topics. And this is a whole topic, but the idea of this retreat, you know, the idea of come to this retreat and use these tools is to become more aware of their own self, become more aware of, as a wounded healer, where you stand. So when we talk about spiritual pain, and the invitation is to, you know, hopefully identify our spiritual pain, is we will see again some definitions. And it says spiritual pain, any unpleasant sensation occurring in varying degrees of severity as a consequence of injury, disease, or emotional disorder. This definition we will use, and we will use a tool that I hope you will like it. And those tools and those concepts, it has been developed by Richard Grove, and Richard Grove is the founder of um, the the Sacred Art of Living and Dying Center in Oregon. He also wrote a book called The American Book of Living and Dying. And it's worth it to read it. I really use a lot in my practice. I use a lot in my trainings, and it helps to learn about the approach of the whole person, learn about spiritual pain, learn about being present and compassionate, present to others. Is worth it to explore. And spiritual distress or spiritual suffering can be described as an emotional state in which people are unable to fulfill their basic human needs for love, hope, purpose, and connection with others, or a situation in which conflict exists between individuals, core values, and their personal experience. As you notice, we are using a anthropological language. You know, even if we are talking about anthropological philosophical language, that can be applied for almost any faith tradition. So we're talking about core values or core aspects of the human being. Definitions of spiritual pain, where we already talked about total pain of Cecily Saunders. It is a pain deep in your being that is not physical. There's another author. Is an intraphysical, as an interpersonal loss of conflict in relationship to the divine. As identical to suffering and complex interplay among various factors. As pain caused by extinction of the being and the meaning of the self. So again, when we invite you to come to the retreat and bring your whole self and look to yourself as a whole person, spiritual pain can come from different dimensions, and they are all connected because we are one person, because we are all connected. So spiritual pain will vary from age, gender, race, and culture, but also can come from all of these 8 dimensions, not just from spiritual issues, but social issues, psychological and cognitive issues, physical issues, disease management, loss and grief. Some people will say we grieve when somebody dies. We grieve when we know the person will die. We grieve when we get to the hospital and we lose our, well, we are grieving now. No, is a precious um, article from a friend of mine, David Kessler, who works about grief and loss, and where he will talk about as soon as after we start COVID, we start to grieve what it was the normal for us. And maybe we say, oh, this doesn't affect me. I'm one of those. No, I say, oh yeah, from my office. I work from my room at the community. It doesn't affect. No, it does affect. And become aware how it affects us, how it increase our spiritual pain. It help us to have a better quality of life, but also help us to heal and have better feel well-being, and also how our relationship with others, with God, is growing, or is getting closer. So end of life issues, maybe it's not the case, but for example, we all have lost a friend or know about somebody who has died from COVID. Indirectly, it does fear us. It does put in us fears and make us deal with some level of fears and uncomfortability. You know? Again, we can use a more simple graphic about the suffering and the spiritual pain. This is done by Betty Farrell from City of Hope. I took from her. I adapt a little bit, but as a caregivers and also as those who have to take care of our own self, doing the cura personalis, it maybe is helpful to look ourselves and says, well, what are the sufferings I'm carrying? What are the situations that are causing that suffering, are causing the spiritual pain? Some research, I excuse myself, I forgot to put the notation, is a research that shows 10 needs that patients normally will present. And here we used to use a list of aspects that will invite you to call for a chaplain or request a spiritual director. Somebody that will journey with you, somebody that will help you in the long road to grow integrally, holistically, as a whole person. Sometimes you will feel some of these, aspects, and that is a clear sign that help should be provided or help should be asked, and for yourself and for others. Again, we go back and spiritual dimension, religious aspects. So now we will talk a little bit about religious aspects, and I will talk a little bit, maybe less, because the whole retreat will present religious aspects. And because we are doing a retreat from a faith tradition. And So when we talk about religious aspect, remember the classic definition of religion. Now comes the Latin of religare, reconnect, and reconnect to God, reconnect to the source of our living. There, the invitation is to, well, look to your prayer life, look to the rituals that you do, look to the sacred that you have in your faith tradition. And is talking about clergy visit, and we use the word clergy because depending, I assuming that at this retreat we will have people is not Roman Catholic, and maybe you have a faith tradition that is not, that you have an imam, or you have a rabbi, or you have a religious leader that provides you with guidance, with a compassionate listening presence. And maybe it's helpful to become aware of those resources and develop a habit of frequency of speaking with that person and bringing up to that person those aspects that you feel compelled to talk. Group support, this is more for caregivers, and find among those who does what you do a group of sharing and support. And I think this retreat is one of those things. This retreat is for caregivers, in the medical field. So what we are doing is we have a vocation is common. We have a common ground, that unite us, even if we are not all physicians, all chaplains, all nurses. We have this caring for others that unite us. Well, we may able to listen and provide a compassionate presence to each other, and their group support is important. Again, some topics that maybe need a specific faith tradition leader to talk, to guide us on it. It's very important not assume. In chaplaincy, we learned that very early, and we should never assume. And what I'm trying to say here is this. I'm Roman Catholic, and when I encounter a Roman Catholic patient, that makes two Roman Catholics. But how that person connects to God, to Jesus, to Mary, to a aspect of their daily practice, and how I do that is different. So I should never assume because we are Catholic, we are all the same. We connect all the same. We practice all the same. Because we are members, because we are part of this community that has a institutionalized belief system, we agree and believe in this, like the creed. But when we go to existential experience, existential aspects, how we connect, what are those aspects of our rich faith tradition enrich me or enrich you? One of the things I will ask is, what of your being Catholic it helps you in your daily life? It nurtures, and nourish you. It helps you, to grow in your faith and your relationship with God. So this is some of the concepts that I like to share with you, and I hope they will be helpful to preparation for the retreat. Please don't hesitate to contact me, And again, it's an introduction, as many aspects I haven't mentioned and I haven't explored deeper, or not explored deeper, shared deeper, but it's an introduction. Hopefully will help and will provide some um, tools for our retreat. God bless you, and thank you very much for listening.